who was able to join us on that last call that we had with World Vision Zambia, that gave us an update on the work that the Break the Cycle team is doing through their Aspen Ride and their Strong Women, Strong World Next Gen. Now we are we're going to have an opportunity to welcome you into a call that the Strong Women, Strong World Next Gen is hosting with my colleague, Christy Urich. And with that, I'll turn it over to Stella, who is our host this morning.
Thank you, Catherine. So today is a discussion about how COVID-19 is impacting women and girls around the globe. So I'm excited to introduce Christy Urich, who is a manager, a project manager with Water, Sanitation, and Hygiene, also known as the WASH program with World Vision in the United States. She's worked with World Vision for 14 years and has been working on the WASH program for 7 years. And I'm also excited to introduce Steph Wojcik, who I'm sure many of you know well, who is the president of the Strong Women, Strong World Club at the Aspen High School, and basically started Strong Women, Strong World Next Gen in Aspen, and I love working with her. She's amazing.
Thank you, Stella, for that introduction. So, Christy, could you start us off by telling us what the impacts on women and girls are in a crisis like COVID-19?
Yes, I'd be happy to. And first of all, thank you for having me here today. And it's really inspiring to see a network of especially young people who are thinking and caring and acting in the world beyond themselves. I have 2 young children, and you are excellent role models for them. So thank you so much for the work you're doing and for supporting World Vision in that work. You know, we're all affected by COVID-19. And I think if you've been doing any reading at all or listening to any sort of news, which we all have been, I think we're well aware that the impact of COVID-19 is particularly acute on women and girls, more so than even the recession we had, 10 years ago. There was a higher impact on men overall, but in this particular crisis, there's a really high impact on women and girls. And a lot of that goes toward, if you think about it in a few different categories, you think about healthcare workers. You know, around the world, a majority of healthcare workers are women, particularly those at the front lines of care, nurses, cleaners, people responsible and most likely to come in contact with the virus in healthcare are women. A lot of community health volunteers who go door to door and care for families are also women. So they are often caregivers and in caregiving roles, and that also puts them at greater risk in the sort of healthcare workforce. The fact that most of us around the world are restricted to our homes or into our more immediate communities, and many countries have very, very restrictive stay-at-home orders for good reason. There are some secondary impacts of that are quite negative on women and girls, in particular in situations of domestic violence, abuse, things like that. Women and girls are disproportionately more affected by that. And in times of stress and anxiety, domestic violence goes up, gender-based violence goes up. And we're seeing that prove true in this crisis in many different countries, including the United States. I was even reading an article this morning from India, and they're seeing increased self-reporting from women and girls of heightened domestic violence and abuse, sexual abuse, and other things. So we see that strong impact on women and unfortunately on women and girls. And also thinking about education, right? I mean, if you all are in school, my children are in school, where nobody's going to school these days. And you know, girls in a lot of the places where World Vision works already have lower access to education, oftentimes because of social norms. Girls' education isn't as highly prioritized as that of boys. Girls are also often responsible for a lot of household duties, which keeps them from school or limits their ability to engage or perform well in school. There are also issues like menstrual health and hygiene that limit girls' ability to engage well in school, particularly when they're menstruating. So all of those are factors that exist outside of COVID-19. You add COVID-19, nobody is going to school. So girls who are already behind boys are going to fall even further behind. And you're dealing in low and middle income countries where the majority of people do not have internet at home. They do not have access to books and materials at home. Maybe their parents aren't very well educated or literate or able to engage in their education at home. So the impacts that students around the world will have on education are going to be multiplied significantly in low and middle income countries, and multiplied even more on women and girls. I think only the future will tell how strong that is. There's an economic impact on everyone, obviously, but particularly on women and girls. A lot of the industries that are most affected in this crisis that are shut down are service-related industries. And women serve a lot in those industries, are the majority of workers in those industries oftentimes. And also in a lot of the countries where we work, and with the community populations we work with, people are working on a subsistence basis. They're self-employed. They might be selling goods that they farm or running small shops, things like that. Those sorts of businesses aren't official. There's not necessarily a social safety net or loans that they might have easy access to keep them afloat during a time like this. People aren't moving around, so they aren't purchasing those goods and services. They don't have paid sick leave, things like that to help them. So obviously the immediate economic impact is very strong. People don't have backup income to support them for however long this lasts. And then of course that will trickle down to after this crisis subsides. And we're just now seeing things start to heat up in Africa in particular. I was on the call with Zambia, if you were there, they said they think they're about a month behind where a lot of the rest of us are. So we're just starting to see the effects of this in these countries. So that's just a little bit of some of the impacts of COVID-19 on women and girls.
So then, given this wide span of impacts, could you discuss what some responses we could have to this, how to fix this issue, both in the anxiety that comes from it, but also in some of the subtopics that you discussed between economics and education? How can we address those?
Yeah, so I mean, there's a few areas that World Vision and others are working to address. And I'll take a step back first and then dive in a little bit into the specifics. I mean, first of all, this is affecting all of us close to home. In our backyard, right? So we can all relate to the impacts of this crisis. So World Vision is working domestically to try to address this issue. You heard some of that if you were on the call with Zambia earlier, so I won't go into that too much, but we are working to engage people in awareness and prayer and advocacy locally, as well as distributing personal protective equipment, providing meals for children, things like that in our own backyard, because we know this is affecting people that support us as an organization and people in our own communities. So we don't want to forget that. And then of course, globally, we're focusing we're responding to COVID-19 in every country where we work, with a heavy priority currently on 17 most significantly hit countries. We're really focusing on prevention in these low and middle income countries, because in these countries where we're working, health systems are not very strong. We have a pretty strong healthcare system in the US, and as you know, we're all really struggling. Think about how much harder that is in countries that don't have these sophisticated hospital systems. They don't have the health facilities that do exist, do not necessarily have access to clean, safe running water, cleaning supplies, gloves, masks, soap, things like that, to practice what they need to do to protect themselves and to protect others. So really, what we really need to be putting our energy on is prevention. And the more we can prevent the disease and keep people healthy, and keep that will prevent as best we can, or minimize serious illness that requires hospitalization, and that just sort of continues to snowball, so to speak. So we're really focusing on prevention, strengthening health systems, advocating to ensure the protection of vulnerable children, particularly those who are in homes that are unsafe, or maybe don't even have, street children, things like that. And really our work in water, sanitation, and hygiene is a pretty critical link to all the areas where we're working to respond to COVID-19. And I'll talk a little more in detail about that in just a moment. World Vision, we can't do this alone. I think we're all realizing these days how interconnected we are and how much our individual actions and choices affect others. So World Vision has realized this for a long time. We work in really close partnership. We're partnering locally with governments, faith leaders, health workers, community health volunteers. We rely on partnerships with partners like based here in the US that are our funding partners and our advocacy partners like you, who are really working to make sure that as we're responding to COVID-19 in our own country, we're not forgetting the impact of COVID-19 on people around the world who have even less of a safety net than we do. So we're really leaning heavily and working together with our partners here. And then we have, implementing partners like Sesame Workshop. I'm not sure if you've ever learned about our work with them, but we have a strong program called Wash Up that focuses on hygiene education in schools. And we're really quickly trying to pivot a lot of those resources since kids aren't in school. How can we use some of those resources to educate our communities and provide some play-based learning for children in homes, and also some emotional support. Sesame has a lot of resources they've created to support parents and caregivers emotionally and how to support their kids through a really trying time. And then we're doing a lot of advocacy work as well, looking at kind of some overarching concerns for children in particular, looking at physical and mental health, issues particularly affecting fragile contexts where things already aren't very stable, looking at increased child protection risks, education. We're really trying to not just think about the immediate response, which we are focusing on, but also what are some of the secondary effects that we're going to be seeing coming out of this. World Vision just published a report called Aftershocks, which is pulling from our learnings from responding to the Ebola crisis and some of the secondary health impacts from that. And how can we sort of draw on learnings from that crisis so that we're ready to respond to some of those secondary effects that will be happening in response to COVID-19. So in particular, talking about sanitation and hygiene, water sanitation and hygiene, we're really trying to, that's a first line of defense for COVID-19. So we're really working to make sure that we can deliver our water projects as much as we possibly can. We are cooperating with government restrictions in the areas where we're working, but the provision of clean water to communities and to healthcare facilities cannot be underestimated. Without clean water, you can't effectively wash your hands, you can't practice effective cleaning and environmental hygiene practices. So that's a really critical link. And we're also working to make sure that as people are collecting water, that we're raising awareness that people practice effective social distancing so that even while they're queuing for water, they're not spreading the disease by standing in a line, so to speak. So, we're working on ensuring that the way we deliver water is as safe as possible, and sanitation as well. And then hygiene, of course, you can't underestimate I think we're all probably washing our hands more. My kids and I were talking about how dry our skin is these days because we're washing our hands so much. And so it's really an opportunity to encourage strong hand hygiene behaviors, but you can't do that without soap and without water. So we're really working to, where we can, deliver those resources to communities, make sure communities have soap, make sure they have hand washing stations, access to water, things like that. And then, there are things, I'll just touch on menstrual hygiene since it is close to my heart. Life continues certain bodily functions continue to happen regardless of what's happening in the world around us. And menstruation is one of those. So how do we ensure that, women and adolescent girls can practice healthy menstrual hygiene when they may not be able to access the products they might typically access because they can't get out as much, or they don't have as much cash to go and purchase items they might need. What we're trying to do in some of the communities where we're working is we distribute hygiene kits. We also call them dignity. We have also a more sort of robust kit called a dignity kit, which we're distributing in places like Syria, which include at least essential items for women and girls so that they can at least care for some of those basic needs at a time when accessing what they need on their own will be a little bit more difficult. So there's a lot more to say about that, but those are some points I'll stop with.
Thank you for that detailed response. That was amazing to hear so many options and opportunities that World Vision as well as Strong Women, Strong World Next Gen are bringing up. I'd like to turn it over to Stella for just a moment. If Stella, you could discuss with us what some of the efforts Strong Women, Strong World Next Gen specifically are doing to try and respond to COVID-19 and how their efforts are helping some of the issues that Christy described.
Of course. So like Christy kind of touched on earlier, women and girls are way more affected. And how do they have their period, or how do they even wash their hands without clean water? So with that being said, we are raising awareness in not only our community, but also our school on how women and girls are impacted by COVID-19 without clean water. And with that also funding for a well, which is $15,000, but provides 300 people with clean water for a lifetime to be clean and give their families clean water and wash their hands and hopefully stop the spread of COVID-19.
Awesome. So one thing that I want to add to that is COVID-19 came to a surprise to all of us, and it just happened to be that the efforts of Strong Women, Strong World Next Gen, as Stella described with the water well that we're working towards, falls perfectly. Unfortunately, we do have to manage this time. However, we are already on our path to finding water. So if we can direct that towards the urgency of COVID-19, that is the ultimate goal at this point in time. Christy, I wanted to come back to you, and could you discuss, let me work on my phrasing, sorry. Can you discuss how communities are responding once they receive these solutions? So in the past, we have had communities receive water wells and receive these hygienic kits, but what impact does it really have?
That's a good question. I think, we're still in the early days of this response. So I can say what I know now, and there'll be more to say, I'm sure, as we walk through this and into the future and see what the real impact is sort of in hindsight. But I think communities are very grateful to receive the things that we're providing. I mean, obviously we're seeing more rapid spread of the virus in more densely populated areas, in cities, urban areas, just like we are in the United States. I mean, the closer people are, the more likely the disease is the more easily the disease spreads. Where we're working in more rural communities, we're really working closely alongside government to make sure that messages are clearly communicated to community members who may not necessarily be seeing the immediate impacts of the virus yet, but we want to make sure they don't. So one benefit we have as an organization is we really have deep roots in these communities we're working in. So many of our staff are from the communities they're working in. We have engaged and mobilized volunteers who know these families that they meet with on a daily basis. So there's a lot of trust there that helps it to be much easier for some of these messages to be communicated. So we're trying to even translate some of the materials that the government may have to communicate about COVID-19 into maybe simpler language, or even using pictorial language where there's less of a lower literacy rate in communities, so that we can ensure that there's a bridge between the message and the understanding, because some of these virus messages can be kind of complicated. So, how do we boil it down to the essence of what people actually need to do, especially in these communities where people are really socially interconnected, and the idea of distance from other people is not always possible, especially, you know, people living in 1 and 2 room homes with extended family. How do you practice safe social distancing? Some of the things we're doing here in the US can't translate to, or can't be applied effectively in some of these other countries. So we're really working to partner well with communities to ensure that those messages are clear and that people understand just how important these preventive measures are. We learned a lot during the Ebola crisis. Hand washing practice went up significantly because it was a really felt need. People saw the effects of proper hand washing, and we think it will be the same this time. And the more we work with local influencers like faith leaders, like we did in the Ebola crisis, we do see those messages being very clearly communicated and received by communities. So that, I think that's what I can say now. I mean, the real impact will be seen as we see how the virus spreads in some of these countries, and hopefully we don't see, we can help sort of stem the tide, or what's the word I'm trying to say? You know, minimize the impact of the virus in these more fragile countries that we work in.
That's very understandable. So with all of these solutions that we're working towards, Stella, could you discuss with us how we are fundraising for a well, specifically NextGen is fundraising for a well?
Yeah, so like I said earlier, we've been spreading awareness. We attempted to have a event up in Snowmass and kind of have a panel discussion with some experts and talk about women and girls and how clean water affects their lives. But unfortunately, according to COVID-19, we had to cancel that. But we did make a video kind of talking about what we were doing and how that impacts women and girls globally. And we are trying to spread awareness all around our community. On International Women's Day, we went to the bottom of Aspen Mountain and just kind of told people about women and girls in Zambia and how they were impacted by having clean water, and donating. People were so fascinated and donated or bought a t-shirt, which was really cool to see. We are also working with a local store called Holly Ann, and we are going to have like a fun event in her store, and 15% of the profits will go to our well, which is really fun. And then we're also, as the COVID-19 kind of settles down, we are hoping to have kind of a mother-daughter like hygiene kit building to then send off to women and girls to continue to not only educate our community, but also help women and girls around the world who need those supplies, who can't afford to go out and buy a box of products. So we hosted a mother-daughter tea last year, and we are excited to have that again this year on July 9th. We hope that you will all be able to join us. And that is attached to the Aspen Invitational. We have a NextGen a team. So we have a team leader already. So if you would like more information, just let us know. Trying to do everything we can to continue to fund a well, as that is extra important now. It's always important to provide that, but even now when people are really needing clean water, it's important. So we are trying to deal with the circumstances and help in any way we can.
And now if we could have one of our club members, Elizabeth DeWetter, discuss another opportunity that we're trying to work towards, joining World Vision on their 6K. Elizabeth, would you tell us a little bit more about that?
Yes, thank you. So we are really excited because Strong Women, Strong World NextGen is going to join in World Vision's annual 6K for water. It's going to be happening on May 16th. And the wonderful thing about this whole race is that we don't need to all be together and start in one place and finish in one place. So anyone, anywhere can participate with their family or as an individual, whether you're on your treadmill in your home, walking around your neighborhood, walking around a track, on your favorite trail. Really, it's accessible to absolutely everyone. And the idea is to raise awareness for the fact that 6K is the average distance that people walk to collect water on a daily basis in underdeveloped countries. And so we are hoping to raise funds to go directly towards the wells that Strong Women, Strong World Next Gen is supporting. In light of this, we are working on creating a registration link specifically for Strong Women, Strong World Next Gen, and this should be coming out in the next couple weeks, so we will keep you in the loop, but mark your calendars for May 16th. And as the link comes out, you will see that you can pay a $20 registration fee. We would love it if you would donate more, but we also decided to lower the fee from the typical Strong Women, Strong World fee of $50 due to the fact that a lot of people are either unemployed temporarily or struggling financially because of COVID-19. We want this to be accessible to everyone, and even if you cannot pay or you know someone who cannot pay but would like to participate, please encourage them to do so. There will be a hashtag coming out that you can tag your photos with your participation with the race. So we hope to see you all there.
Thank you, Elizabeth. I know that that's really great because you can obviously do it from anywhere in the country. And I think that ties in really nicely to what we are doing with Next Gen by trying to plant seeds all over the country and even the world to get a bunch of young women and men who are passionate about what Steph and I are doing, along with you, Elizabeth, and everyone else in our club. So I think it's really great that we can do that from anywhere and become closer through such an isolating time. So to close up, thank you, Catherine and Christy, for the work that you guys are doing and for helping us understand the impacts that COVID-19 has on women and girls around the globe. We are extremely encouraged to know that the work that we are doing directly impacts women and girls and just the challenges ahead in general. And thank you to all of the guests who joined us today. This has been recorded, so if you know anybody that couldn't make it today or you want to share it, please feel free. We will send that out in an email along with some more opportunities for the future, like some of the stuff that I mentioned earlier. We hope that you guys will all help us and continue to reach out with questions and help the Next Gen movement, even just by emailing Steph or I or sending someone our way who wants to be involved. Stay safe, healthy, happy, and thank you for your time today.
Thank you all so much for joining.
Thank you so much, and
I
thank
went
you
to
for
make my donation.
You. Thank
what
you.
you're doing.
Bye-bye.
You can make a pledge without